Yes, thank you very much, Edgardo. Ladies and gentlemen, it's a real pleasure to be here today and to continue this very important and interesting discussion. My name is Daria Cibrario, in charge of local government at PSI, and I have the privilege and the honor of introducing and moderating the next panel of distinguished speakers. The theme of the next panel is going to be local public services continuation and worker safety at time of COVID. Can you hear me? Yeah. What are the challenges, but also what are the solutions? You've actually touched upon many of these already in the previous session. In this new table, we will look together at the practitioners who will speak in a moment. What are really the concrete situations and solutions that have come up on the ground in a number of countries? So I'm particularly looking forward to the discussion. I will introduce the speakers one by one so that I think it will be a little bit more time effective. So if you agree, I will start immediately with Jon Richards. Jon, if you're there, get ready. Jon is head of local government at UNISON, which is the UK's largest public service unions, and representing public service workers both in the public and the private sector. Jon has been part of earlier live learning sessions, and he was actually jumping in and out precisely because he was coping and dealing with the crisis and with some of the challenges that he's going to talk about for workers on the front line. So let's start with Jon, and there should be a presentation. Thank you.
Hello. Yep, hopefully the presentation will come up. I'm ready when people are. I made Daria, as I said, I sent Daria until very recently the wrong slide. So I'm hoping that these are the new slides because there's a very bad mistake on the last one. But so this is what I want to talk about, is that public sector workers on the front line and risking their lives for workers and for the public. And the question is, what should governments be doing in return? There is a commitment between you when you contract your labour over to an employer, and certainly in public services to the government, an expectation and an understanding that we put ourselves on the line for the public. But actually, that means that there should be a bond of trust between us, and governments need to reflect what we say. So if we could move on to the next slide. So I just want to talk a little bit about the last one, please. That went, thank you. Went on to the last, just a little bit of what's happened to us. The UK now, United Kingdom, now has the most deaths in Europe, and we are now the only second behind the United States of having the most deaths in any country. And this was because we were our strange British spirit, but we are very slow to go into lockdown. We were 2 weeks maybe slower than many other countries, and this meant that the actual virus got a hold far quicker than it should have done. And what it means is that now we are plateauing, and many other countries are on the way down and easing themselves out of lockdown. The problem is that our government seems to want to get out of lockdown at the same rate of other countries, yet we are 2 weeks behind. And what that means is there is a real increased potential of risks and threats to our workforce who are currently in there, and I'll explain that in a minute. Now, in the main area of deaths now are no longer in our health service, as has been for many other ones. They're now in our care homes, where older people particularly will move quickly out of hospitals to make space in the hospitals for other patients who had coronavirus, and this is now spread in our care homes. So there's something about planning between our different systems of central government planning and then working in the home care system. So then remains continuing risk to workers. There are contradictions in the new proposals from our government to move out of lockdown. So the public is told to keep the distance. We're allowed now to do more exercise in the park as from today. But actually, and some of our workers have been sent back told they can go back into work. But what we haven't done is we haven't changed the public transport system. So our public transport system is still running as though we have not got out of lockdown to protect the public service workers. One of our main areas of deaths, a surprising high area, has been bus drivers who have been particularly targeted. But what we now have is we have all these workers who have now been told they have to return to work are now crowded onto trains and buses and plans. So again, there is a problem of dialogue in our system between central and local government and planning, which we just don't think is good enough. And again, our testing capacity is also not good. Our testing capacity was much lower than many other countries. You know, we look at South Korea with envy. It was very poor. It's still very poor. It's mainly targeted on health service workers. But as I said, things have moved on and we have problems with home care workers who can't get access to protective equipment. So there again, our systems are running behind the reality and our government doesn't seem to be able to catch up with that. I won't go too much now onto the details of the engagement social partners because Mads and colleagues have already spoken very well about the need to engage social partners. But what we see again in our country is that central government is more of a dictator and dictates too strong a word. It tells people more what it wants to do and doesn't engage us properly in the debate. We have much better dialogue with local government. We have much better chance to influence them. Not everywhere. We have our disputes. We have our problems. But local government, central government, apart from our health service, where we have a functioning and a proper European style social partnership forum, we don't really have that dialogue with the employers properly, and that means that we get into conflict. And one of the reasons I was late on today was that I'm dealing with a real big problem we now have about reopening schools, which I'll touch on in a moment. So on to the next slide. So these 4 points I wanted to talk about lessons we've learned, and the lessons that we've learned and still aren't learning is that communications and science are vital. So what I see at the moment is in schools, for instance, the problem I'm dealing with today, again, the government have said that it's safe for, it's not safe for the public to be allowed to socially distance. However, in certain areas, it is safe and people don't need protective equipment, particularly schools. So our government is moving today to a situation of moving in and getting getting primary schools, some pupils in primary schools back into them, the very young one, and they tell us this is safe. Unfortunately, they have not provided us with the science that shows this is safe. We pick up we hear from, say, Denmark, where the schools have gone, we hear from the Netherlands, but we've never been provided with the information that gives us the confidence to say to our members and our workers, this is good science, we can believe and we can trust that. So only now, having told us on Monday that we will be moving out from schools, only this Friday are we now being invited to meet some of the experts. But we know from some of the experts, the things the experts have said is some of them contradict each other. So we don't have that trust. So getting the science out quickly, simple, easy message is really key to moving on from lockdown. The flexibility of local government has been really vital during this whole process, and we've played our part in this. We have helped workers redeploy, we have moved people across, but what we've insisted to do first thing is, start with volunteers. Let's not transfer. And actually, within most cases, the volunteers have worked. It's been really helpful. People have redeployed. But again, where there have been problems, where there have been mistakes, there have been serious mistakes. So I have a case, not too long, a terrible case where a worker was seen as a street cleaner, was moved on to work on the refuse lorries. They assumed that because he knew how to sweep the streets, he would know how to work the lorries. Unfortunately, he didn't. He got caught up and has now been very badly injured in one of these refuse lorries. So you can see how the importance of training, the importance of not jumping to conclusions can really undermine it. But in general, the flexibility of local government has been something we've learned out of this. But what we've also seen as a result of that is that local government have been hampered and undermined, particularly by funding. We have gone through a period, as many people around the world have, of of austerity, it's been really problematic, and government services have been run down, but also the planning services that would get us out of this have been run down. The services that would allow us to do have been really problematic. So I'll move on to my last point, and the question, the final point is, are workers sacrificed? And I'll give you an example of where we still see potentially workers sacrificed. And that's in places like, I've touched on refuse workers, and refuse workers are still being crowded 3 people to a cab with no personal protective equipment. Now, this has been a particular issue with some of the larger the larger outsource companies, and those larger outsource companies don't have the flexibility, say like local government have been able to utilize other drivers who are currently being redeployed to drive people behind in vans, and those people can be socially distanced, but the private companies don't have that flexibility. They run on very narrow profits, and so they haven't issued those. So that for me is an example there. So I'll end there. I have plenty more examples, but I hope that gives you a flavor of some of the challenges we are facing as we come out of lockdown.
Thank you very much, Jon. This was a rich presentation, such a short time, and I will touch on some of your points in the wrap up. But let's stick to that key concept of flexibility for local government and direct control in a moment of crisis, the possibility of changing things rapidly, fixing them, and also the role of the union in making sure that the right messages come down to the workers and the trust is built. And you talked about South Korea, which actually takes me to the next speaker. I'm very pleased to give the floor next to Dr. Mi-Jeong Park, who is a senior specialist for international relations, representing the city of Goyang in Korea. She's also been an employee of the World Bank. And Goyang City is a very fast-growing and active city, also a leading example in the country for environmental policies. So Dr. Park, we are listening to you next on this topic. Thank you. There should be a presentation.
Yes. So could you please help to show up my presentation file here? Thank you very much. And many thanks to Emilia and Edgardo for having me a part of the relevant session. And also thanks Daria for giving me the floor. Goyang is one of the largest city in capital area in South Korea, having 1,070,000 inhabitants. Goyang has been also defeating the threat of COVID-19. In the meantime, it's been spotlighted by many foreign media and countries around the world because of its initiatives, which are the first trial in the world and are success cases to preventing spreading virus in advance. Goyang's overcoming strategy has 2 key parts: for people to learn what to do and to practice what they learned. The point is that Goyang puts its focus on implementing practical policies to make it easier for citizens to act on, such as opening the first drive-through testing station, installing hand washing stands connected to water supply even on the streets at major subway stations and parks to help the citizens passing by can wash their hands easily anytime. For economic boosting, the city cut 50% of the water bill and also another 50% cut in loan rates, and also running drive-through safety store for farmers. To help those in self-quarantine, temporary self-quarantine facilities were installed at the camping site and delivering PPE kits to vulnerable groups, including seniors and pregnant women. There are many more initiatives Goyang has done, but please refer the website Cities for Global Health. For this, public workers need to put more tasks on their to-do list, such as disinfection, checking status of those in self-quarantine, helping doctors and nurses, checking temperatures of passengers, and then keeping eyes on religious groups, and then providing the special disaster funding, etc. So almost every worker should stay in position office for continuity of the robust public services. For safety of the public workers, administration fulfill the office disinfection every day, setting hand sanitizers and providing face masks for workers facing visitors, setting the transparency shield in every face-to-face service places between officials and visitors. And anybody who works outside of the office to check the body temperatures and the support doctors, nurses should put on the protective clothes. And anybody has some symptoms, stay at home on official leave. In every buildings of the city hall and county office and for operation sites, they keep just one single entrance gate open and put thermal imaging cameras to check body temperature of all visitors. There is necessary of deploying more staff here and there. Public servants should stay late or on weekends. To reduce and disperse the pressure of the burden, city directly hired newly over 500 people for task force team, especially including professionals with experiences as nurses, aides for specific tasks. And also city provided a financial complement for overtime and special leave under the Civil Service Act. Till now, no one has been contaminated among public workers. Please, next pages. The original of Goyang's performance, origin of Goyang's performance is communication, actually. The first, the disaster and safety management meeting held every morning on January 26, when the first patient was detected, chaired by the mayor of Goyang. Mr. Mayor met directors, managers from all divisions and officials from the fire authorities and the public health offices, and then received a report from the participants to discuss responding measures and the new ideas every morning. And emergency dialogues with the social communities and then doctors from the local hospitals are held. And we operated disaster centers to stay open 24/7 for responding to any situation. These efforts make us having less than 40 confirmed cases in Goyang. Second, administration collects opinions of the hands-on workers. Goyang Labor Union indicates their stances by sending official letters whenever issues occur. Public officers could show their status on website anonymously. Sometimes there's pro and con discussions and debates created among workers. According to this interaction, we control and manage our working standards and directions to keep average satisfaction. We've been having a hard time to maintain the same level of services, but fundamentally, public workers as a frontliner to help the citizens to overcome the crisis willingly accepted the responsibilities and obligation due to understanding. They are happily working late hours and keeping more concentrated on their self-prevention for public safety. It's difficult to stand though. Mayor of Goyang hasn't been sleeping well, is struggling for the right direction and actions. Public servants follow and work together in the well-planned and flexible systems with the trust. Through this internal solidarity, we can overcome and build strong public services in the COVID-19 aftermath. Thank you.
Thank you very much, Dr. Park, for having been in the time and for having touched on to the challenges that the city of Goyang has faced, and notably having touched on the workload, excess workload that COVID has meant for frontline workers and how you have been reorganizing the service. We will mention that at the end as well. Now, please let me transition to Carlos Carrion Crespo. Although he's mentioned at the end of the agenda, we have to bring him up right now. So Carlos is the Public Service and Utilities Specialist at the ILO, the International Labour Organization, which is the only UN tripartite agency bringing together governments, employers, and workers. And the guidelines that were, the ILO guidelines for decent work for emergency workers that were mentioned at the beginning of the session are one of the issues that Carlos is going to touch upon and very relevant to this discussion. So please, Carlos, if you're there, I would like to invite you to take the floor, and there is a presentation which goes with your intervention. 5 minutes, please. Thank you.
Thank you. Are you going to put the presentation? Okay, yes. So you can go to the next slide right away. In addressing the issues around local public services, we must first recognize the difference between the sources of revenue that national and local governments depend on. Municipalities tend to rely on taxes paid by businesses that have been severely affected by businesses that have been severely affected by the crisis, and many have laid workers off. National governments should replace these incomes. And these are some of the messages that have been voiced throughout this session. Confronting the pandemic will transform economies, perhaps irreversibly. Countries with high technical capacity may make e-government measures permanent and widespread, while others without this capacity may lag behind. Public administration and utilities in the advanced world are two of the few sectors where capacity and need almost match, but many others have had poor exercises of e-government. In those who do have the capacity, the measures raise questions on the role of technology in the new workplaces that are going to emerge from the crisis. Next slide, please. Municipalities employ many health workers and other first responders who cannot abandon their work, but they should also not be forced to engage in excessive risks either. This is one of the main messages of the ILO's guidelines on decent work in public emergency services, adopted in 2018, and that Rosa and Daria have both mentioned. These contain proposals for action to provide employment stability, workplace safety, health guarantees, and social protection to public emergency service workers, including volunteer workers, so they can dedicate all their energies to protecting communities. They also provide recommendations for social dialogue, training, and interagency coordination so public servants can share their knowledge, have a voice in their work environment, and be fully prepared to confront the growing threat of disasters, epidemics, climate change, and violent acts. So, next slide, please. There are many other groups of workers at the, no, that was the previous slide now. There are many other groups of workers at the local level that are key to the recovery. Those are social protection programs, health workers, water operators, particularly in countries with insufficient access to safe sanitation and hygiene, sanitation and mortuary services that prevent additional health threats, communications offices that share information with people and share experiences with other governments at all levels. Mass transportation services that were mentioned in the previous presentation ensure the mobility of essential workers, and they do it at great risk. And unexpectedly, wildlife protection services combat wildlife trafficking, which help prevent zoonotic diseases like COVID-19. Correctional services also protect inmates housed in confined spaces, which are conducive to contagion. And the court system that needs to prevent discrimination, abuse of technological monitoring, and address employment and financial disputes. Underlying each one, not yet, of these public services are public servants of all levels of hierarchy, and their knowledge and the reality on the ground is essential to build the expertise that support local administrations and build the essential trust that we need at this time. For this, local governments should exchange information with the unions and consult them when the changes needed affect their working conditions. These workers must also carry out their tasks without improper external influences. Next slide. There are many ILO instruments that require or propose policy measures that promote a human-centered approach to the current crisis and its recovery. You can see them on the screen. And some of the tasks are that public employers should keep offices and equipment properly maintained and cleaned, provide sufficient wholesome drinking water and other wholesome drinks, sufficient and suitable washing and sanitary facilities, and adopt measures to prevent the spread of transmissible diseases. Employers should provide appropriate training in occupational safety and health, ensure that worker representatives receive adequate information, and the on measures taken to secure their safety and health. Workers and the work organizations should be consulted and allowed to inquire into OSH issues. Workers must also comply with workplace safety and health requirements. The ILO should also protect the rights at work, safety and health and working conditions of all governments engaged in crisis response, and recognizes the importance of good governance and combating corruption and clientelism in the prevention of emergencies. The government should adopt measures to protect workers who are more likely to suffer violence and harassment, like health and emergency services, transport and social workers, and those who work in isolations. Issues that affect these workers must be addressed at all levels and through an international integrated approach similar to the one adopted to confront the HIV crisis, adapted to the particularities of COVID. Thank you very much.
Thank you, Carlos, for being so eloquent in such a short time. Again, I'll touch on some of the key issues at the end, but just to tell you also that the guidelines that were mentioned are also one of the first instrument in the ILO that really recognize the key role of local and regional government in delivering public services at the local level. So a tool that can be really useful for both our partners on either side. And I'd like to highlight the point that Carlos made again, by talking together, our constituents can really build together the expertise and the trust, which are so needed, especially in the partial lift and progressive lift of the lockdown. We are now at the point where we can bring in Mr. Zanin. Again, apologies, Mr. Zanin. We had to reshuffle the agenda to allow Mr. Carlos to leave a bit earlier for another commitment. Thank you for being with us. So Mauricio Zanin is a coordinator on international cooperation at the CNM, which is the Brazilian Confederation of Municipalities and the largest peak organization for municipalities in Latin America. He's also a coordinator for the Proyecto Innova Juntos, which is one activity, I imagine, of the CNM. So please, the floor is yours for the next presentation, and I trust there are a few slides. Thank you.
Ok, muchas gracias. Bien, yo agradezco a todos. Yo voy a intentar ser bastante objetivo aquí para compartir un poco de las experiencias que nosotros hemos tenido con el enfrentamiento del coronavirus en Brasil. Bien, ¿cómo va a ser esta presentación de los 5 minutos? Primero va a ser un dibujo del problema que hemos tenido, después cómo la CNM se organizó en estas cosas y las soluciones que hemos logrado éxito. Es muy importante retomar los puntos que han hablado Emilia al comienzo sobre la importancia de los trabajadores de los municipios, cómo garantizar las condiciones de trabajo efectivo para esos trabajadores y para las personas que también son personas que tienen un subcontracto, que no están directamente en la administración, y en este proceso de desconstrucción de los servicios públicos pueden traer muchos problemas. Entonces, bien, déjame presentar muy rápidamente un poco de la realidad de Brasil, de la dimensión del tiempo y cómo hemos manejado eso. Brasil es un país muy grande. Si tú quieres, tú puedes recortar el mapa y poner toda Europa dentro de Brasil y ainda sigue con espacio. Somos muy grandes, tenemos muchos problemas en Amazonía, tenemos problemas, por ejemplo, con fronteras de Venezuela, con la cuestión de refugiados, tenemos frontera territorial con Francia, con la Guyana francesa, sí, es un sitio bastante distinto, es casi un continente. Un problema principal que nosotros hemos visto es que la preparación para el COVID-19 no ha sido bien hecha en muchos países de Latinoamérica. Y nosotros hemos tentado interactuar de una manera distinta. ¿Qué pasó con nosotros? Cuando empezó los problemas en China, hemos echado una mirada y diciendo, bien, esto va a ocurrir. Cuando llegó a Italia y los números empezaron a crecer, nosotros de CNM nos pareció la pretensión de que tendrías que hacer algo. Cuando ha sido decretada la pandemia, nosotros cambiamos todas las acciones de CNM para garantizar las condiciones de combate al COVID en nuestros municipios. Nosotros tenemos de 5.568 municipios, una cantidad muy grande de municipios que sobreviven solamente bajo la transferencia gubernamental, de la recaudación que va a recibir. Entonces, como cuando estamos pensando en los trabajadores, nosotros teníamos un problema. ¿Cuál es el impacto de esto? No teníamos ni idea. Entonces, podríamos tener una baja de la recaudación de 30%, de 50%, de 70%. Con una baja de recaudación de 70%, eso iba a ser no el colapso de la salud, pero el colapso de todos los servicios públicos, porque nosotros no vamos a poder pagar a la gente. Entonces, al mismo tiempo, nosotros miramos la pandemia como si fuera, por ejemplo, un tsunami que alguien sabe que ocurrió y va a llegar en su país. Tú miras el ola del tsunami llegando y ¿qué tiene que hacer? Tiene que arreglar el máximo y más rápido posible todas las informaciones que pueda para salvar lo que pueda. Entonces, una información antes, por favor, un slide antes. La primera cosa que ya ha sido dicha, que no teníamos información pues para nada. Hay una subnotificación gigantesca. Entonces, ¿qué hemos hecho? Nosotros llegamos a acuerdo. Necesitamos saber qué está pasando con los municipios. Llamamos a todos los alcaldes. Hemos hecho un sistema con estas informaciones que tú puedes dibujar en el mapa, la situación de los municipios, la situación, además de los datos oficiales de la Secretaría de la Salud, del Ministerio de la Salud, que ahora están buenos, cuando no teníamos nada, llamamos a todos los alcaldes y preguntamos, ¿qué pasa ahí? ¿Y qué está ocurriendo coronavirus? ¿Que sí, que no? ¿Cómo ocurrir? Entonces nosotros hemos podido nos anticipar para saber cómo hacer este esfuerzo. Segundo punto, la próxima diapositiva, por favor. El punto que quedó muy efectivo para nosotros fue cuando la declaración de la pandemia, nosotros hicimos un cambio de todo de CNM para combatir el coronavirus. ¿Y cómo es esto? Necesitamos de plata, necesitamos de recursos para garantizar la normalidad de la gestión pública. Y en esto, yo voy a hacer una simplificación aquí. Esto, por ejemplo, es un relatorio de las conquistas que hemos obtenido con esto. Son cerca de 120 billones de reales. Un real más o menos estaba cerca de 5 para dólares, entonces algo tú podrás dividir por 5. Cambia un poco el valor y todo más, pero estamos hablando de un valor de entre 20 y 30 billones de dólares que hemos garantizado para poner en marcha la manutención de los municipios. Para esto hemos trabajado muchísimo, muchísimo. ¿Y cómo? Interactuando con el gobierno central, haciendo parte del Comité Nacional de Crisis, colocando todos los nuestros técnicos para discutir. Hasta 3 meses atrás no tenía ni idea de lo que era una pandemia. Ahora casi que soy un experto de tanto que hablo con la gente de estos puntos y necesitábamos arreglar las cosas. De 120 billones de dólares, la mitad son deudas que nosotros vamos a posponer para que los municipios puedan pagar más allá. Y 160, la mitad, nosotros vamos a conseguir en plata con una división, con cosas muy específicas que vamos a ver aquí. Pero ¿qué es importante? En 4 puntos hemos focado. Vuelvo otra vez, vuelvo una diapositiva. Recursos para la salud, recursos para la asistencia social y recursos para la gestión funeraria. Cuando el municipio va a recibir ese recurso, necesitamos garantizar que él pueda comprar urnas funerarias, por ejemplo. Entonces, hemos liberado 2,5 billones de reales para la asistencia social y trabajado para simplificar la legislación de compras gubernamentales para que pueda hacer la gestión. Estamos en una guerra. Guerra es muy hermosa por la parte de decir que se está trabajando bien en las batallas, pero se vence la guerra con la logística. Entonces nos fuimos bajo del capó del carro y trabajar con las cosas de la logística para garantizar estas informaciones. Siguiente. Después de esto, hemos dicho el siguiente: nosotros necesitamos ser el ejemplo de combate de coronavirus porque no tenemos pues ninguna idea de cómo hacerlo. Y 3, 4 meses atrás no la teníamos mismo. Entonces empezamos a estudiar muchísimo y hemos arreglado un conjunto de cosas. Por ejemplo, en nuestra organización implementamos todo: álcool gel, trabajo remoto, cómo se hace, cómo no se hace, los protocolos, todas las cosas han sido empezadas con nosotros. Teníamos un evento internacional, la cumbre hemisférica de alcaldes, con 3.000 alcaldes de todo el mundo para venir en Recife. Lo hemos cancelado de inmediato y hemos empezado a trabajar. Y hemos puesto para todos los municipios organizaciones, explicaciones objetivas, un plan emergencial de acciones del municipio, informaciones objetivas de cómo decretar la pandemia. ¿Por qué? Porque sin la decretación de la pandemia, el alcalde no podría gastar la plata con la manera especial para comprar cosas. Entonces, necesitamos garantizar que las personas tendrían esa condición. Más de que eso, hemos empezado con algunas acciones, una tercera línea, o sea, acciones de obtención de plata. Segundo punto, acciones de formación y de información. Y acciones, no, por favor, y una acción de garantizar protocolos específicos para que puedan, para que puedan poner los procedimientos en la salud básica, porque en un municipio pequeño, en la Amazonía, la persona no sabía cómo debería hacer, cómo debería utilizar. Entonces hemos hecho esto. Por favor, yo ya termino, no estoy atento a mi tiempo. Un punto importante, vuelve una de diapositiva, por favor. Una más. ¿Qué hemos hecho? Para todas las cosas, en cada uno de los puntos, para los trabajadores, nosotros tenemos orientaciones de cómo hacer para la cultura, combate en consorcios públicos, desarrollo rural, defensa civil, educación, innovación, finanzas. Cada persona técnica ha tenido la misión de hacer una cartilla muy simple, diciendo cómo la cultura y el tránsito o la salud o el saneamiento va a trabajar los procedimientos operativos de combate al coronavirus en todas las áreas de atendimiento. Y a siguiente, por favor. Después de esto, hemos empezado, tenemos un canal, somos bastante grandes.
Señor Zanin, por favor, tenemos que cerrar.
Tenemos un canal de televisión y una radio, entonces hemos empezado a hacer de estos canales la parte de la divulgación oficial de la información de las liberaciones de Brasil. Hay problemas políticos serios de entendimientos y otras cosas, pero esta información, este trabajar para garantizar la plata es fundamental, porque hoy cuando la persona de São Paulo quiere hablar con la alcaldía, necesito más urnas funerarias, la alcaldía tendrá plata para pagar por este tipo de servicio y es una manera de garantizar la continuidad de los servicios y no el caso de pérdida de los empleos. Bien, es esto. Muchas gracias.
Thank you very much, Mr. Zanin. And sorry, I had to push you a little bit. We're a bit short of time, but it's a really rich presentation. And of course, all participants will get it so that they can look at it. And thank you for stressing the important work that mayors are doing in self-organizing themselves, especially in a situation where the central government is a bit of a challenge right now. So what I would like to do is then to pass to the last speaker of this table, who is Mr. Makrem Amaria. Makrem is General Secretary of the UGTT Local and Regional Government Workers of Tunisia. And he is a man who really works very closely on the one hand with the workers on the ground, but also with mayors, and in the audience there is a number of local government representatives from Tunisia right now. So Makrem, the floor is yours, and please, there should be a presentation which goes with it. Is there? Yes, I think so. Makrem, are you with us? Just a second, we're checking with the, yeah.
Yeah, Makrem, you have to unmute your channel.
Yeah. I'm sorry, I made a mistake. I actually said he's the last speaker. There is also Bernard Dreno. My apologies. So, but please, Makrem, go ahead. And then, sorry, Bernard, you're next, please.
Daria, if we can go with Bernard and then we go back to Makrem.
Fine. Then let's go with Bernard. Bernard, if you're there, please get ready. So Bernard Dreno is Occupational Health and Safety Specialist for the French branch confederation CFDT Interco in France, which represents local and regional government workers in the municipalities, in the departments and regions of France. Bernard, you can go ahead. Apologies, Makrem, I've made a mistake. Sorry.
Oui, bonjour. Je ne sais pas si vous m'entendez. Oui?
Oui.
Bon. Je n'ai pas de retour et moi, je ne vous entends pas. Ah bah très bien. Oui, alors quelques nouvelles de la France. Le vendredi 13 mars, les décisions gouvernementales ont bouleversé les organisations de nos collectivités et établissements territoriaux. Donc à peu près 2 millions d'agents se sont retrouvés à revoir leur travail, leur modalité de travail. Les élus ont dû décider en urgence de ces modalités. Souvent sans concertation, l'urgence n'a pas toujours permis malheureusement de consulter les représentants des personnels. Et les agents, souvent, sont allés en première ligne, mais malheureusement mal équipés, mal protégés, mal informés sur le risque, anxieux pour leur santé, pour la santé de leurs proches et de leurs familles, et se sont très vite retrouvés épuisés par les tâches qu'ils avaient en charge. Mais néanmoins, les agents ont répondu présents dans tous les secteurs d'activité, dans l'eau, l'assainissement, les déchets, l'état civil. Le service aux citoyens était rendu. La police municipale a joué aussi un grand rôle. Et à ce titre-là, effectivement, les citoyens ont pu bénéficier d'un service quand même de qualité. Mais ce service de qualité a été rendu en mettant en tension les organisations. Ces organisations qui n'étaient pas préparées, malgré l'ensemble des crises que nous avions vécues auparavant, et qui, du coup, a mis en grande difficulté un certain nombre d'acteurs dans les collectivités. Parallèlement, le cadre législatif et réglementaire s'est adapté, la commande publique aussi, les modes de consultation à distance, de réunion se sont mis en place et les procédures ont été allégées. Ça pose quand même la question, pour un grand pays comme la France, de sa capacité à tirer des enseignements des crises passées. Et c'est vraiment une question importante qui devrait être traitée dans les suites qui seront données à cette pandémie, car après la canicule, après H1N1, après le coronavirus, aujourd'hui, nous sommes toujours pris au dépourvu. Et malheureusement, nous manquons de capacité d'anticipation pour gérer ces crises. Mais cette crise a permis en fin de compte d'apprendre quand même, en mettant en place des organisations qui peuvent devenir pérennes et qui peuvent s'enrichir par, en particulier, le rôle essentiel que doivent avoir les représentants des personnels, les institutions consultatives et aussi tous les professionnels de la santé. On pourra réaffirmer le rôle des services publics, puisque là, ils ont été effectivement au cœur de la citoyenneté. On pourra réactiver et réinterroger les outils de gestion de crise, les plans de continuité d'activité, les plans de sauvegarde, et surtout, ce qu'il faut, et avec une attention particulière, c'est de sans cesse améliorer les conditions de travail, préserver les collectifs de travail qui ont été malmenés durant cette crise. Et effectivement, pour cela, rendre acteurs les agents et leurs représentants syndicaux à travers un dialogue social et de la négociation, et surtout en temps de crise, puisque malheureusement, en période de crise, souvent les employeurs s'exonèrent du dialogue social. Merci.
Thank you very much, Bernard, and sorry for the glitch. You were spot on time, and thanks for this important contribution from your presentation. There was an issue of disconnection with Mr. Makrem Maria, but Makrem seems to be back online. So please, Makrem, the floor is yours, and you have the last word in this roundtable before we wrap up. Please switch on your mic and the floor is yours. 5 minutes, please.
D'accord. Vous m'entendez là, non?
Yes, on t'entend bien. C'est bon, vas-y.
Merci. Donc, c'est un grand bonheur pour l'Union générale tunisienne du travail du GTT que je représente de pouvoir vous faire part de la situation ici en Tunisie. Je remercie la CGLU et l'ISP de leur sollicitation et je vous remercie toutes et tous de votre attention. Sachez qu'en tant que secrétaire général de la Fédération des municipaux, je travaille quotidiennement avec les maires tunisiens. Nous avons de nombreux défis que revolons ensemble. Comme le temps de parole est très court, je vais aller à l'essentiel. Le processus de décentralisation engagé en Tunisie fait que depuis mai 2018, les municipalités tunisiennes sont désormais autonomes. En revanche, elles souffrent d'un manque de ressources financières et humaines, ce qui affecte les conditions de travail des municipaux. Durant les 2 dernières années, les accidents de travail se sont multipliés. Les maladies professionnelles sont de plus en plus fréquentes. Si je dois tirer au moins une chose positive de cette crise du Covid-19, c'est qu'elle a permis une prise de conscience de l'importance de protéger les travailleurs et se soucier de leurs conditions de travail. Cette prise de conscience concerne les maires, bien sûr, mais je dois le dire aussi qu'elle concerne la sécurité. Au regard du Covid-19, je voudrais vous faire part en particulier des travailleurs du secteur du funéraire, car il est un bon exemple de ce que le dialogue social a pu apporter ici en période de crise. Dans ce secteur du funéraire, faute de moyens et d'agents formés, il y a eu dès le début de la crise en Tunisie des cas de décès dus au Covid-19. Avec la Confédération des maires tunisiennes, nous avons donc réalisé un communiqué conjoint appelant le ministère de tutelle à assumer ses responsabilités et à prendre un certain nombre de mesures. Des mesures en matière de formation au nord, en matière d'équipement de protection ou encore s'agissant de tester toutes les personnes décédées avant de procéder à l'enterrement. Le ministère de tutelle a réagi positivement à cette initiative. Plusieurs de ces mesures sont actuellement en cours d'implémentation. En conclusion, je voudrais dire que la crise Covid-19 pose évidemment des défis énormes, mais elle constitue en même temps une occasion pour valoriser le travail des municipaux et améliorer la gouvernance locale. Notre analyse de la situation en Tunisie fait ressortir 5 principaux points d'action que vous pouvez lire dans le PowerPoint. 1. Garantir les ressources financières des municipalités. 2. renforcer les capacités des agents municipaux en matière de santé et sécurité au travail pour garantir une application effective des normes et réduire les risques. 3. Renforcer aussi les capacités des élus locaux en matière de gestion administrative et financière. 4. Il faut un véritable statut pour les travailleurs municipaux qui accordent une attention particulière à la protection sociale et sanitaire des agents. Je voudrais attirer votre attention en particulier sur le dernier point 5, recruter au sein des municipalités et faire cesser le recours à la privatisation des services publics. En Tunisie, les recrutements publics ont été gelés depuis 3 années du fait des nouvelles conditionnalités imposées par les bailleurs de fonds, notamment la Banque mondiale et le FMI. Dans ce fait, recours à la privatisation est de plus en plus encouragé aux dépens du service rendu aux citoyens. Je pense notamment aux services de collecte et de traitement des déchets. Or, il faut savoir que dans ce secteur, la majorité des sociétés privées offrent des emplois très précaires et des conditions dangereuses de travail. J'espère que CGLU et l'ISP pourront nous aider dans ce combat contre la privatisation ainsi que nos autres revendications. Merci beaucoup de votre attention.
Merci à toi, Makrem. Thank you very much. And I think it was really good that you were at the end of the table because your wrap up in 5 points is really resuming and summarizing the key findings of these roundtables. So thank you very much for such a clear presentation and for helping me to keep the time, because with those 5 points, I think we are ready to pass the floor back to the UCLG General Secretary, Emilia Saiz, to start with the wrap up and conclusion. So thank you very much to all the speakers and sorry for the technical and agenda reshuffling issues. Thank you.